The topic is gout. Gout is an inflammatory condition caused by excess uric acid. Now, we all have uric acid in our bloodstream. Under normal conditions, the uric acid is flushed out through our kidneys. Clients who present with gout will have an excess accumulation of uric acid in their bloodstream. It then forms into crystals and will accumulate in the synovial fluid of joints. As our illustration shows, the great toe is a common place for gout to occur. There are clients who will be at risk for developing gout. Those with metabolic syndrome, such as obesity, hyperlipidemia, and diabetes mellitus. These clients have a higher level of uric acid in their bloodstream. They also have a more difficult time excreting the uric acid from their kidneys. Clients who consume a high-protein, high-fat diet are also prone to developing gout. This is due to the breakdown of protein into uric acid. Excessive alcohol intake. Alcohol contains high levels of purines. Purines break down into uric acid. When clients use diuretic therapy, we are increasing urination and elimination of volume. By doing that, we are decreasing volume in the bloodstream, which will increase the uric acid level. Clients who have polycythemia vera, this is an excess production of red blood cells. Again, this increases cell lysis within the bloodstream, which leads to the byproduct of uric acid. A client with acute gout will experience severe pain, joint warmth, redness, and swelling, and even possibly a fever. As you can see in our illustration to the right, that joint is inflamed and red and tender. Diagnostically, a serum blood test can be conducted to detect uric acid levels, as well as direct aspiration of synovial fluid from the affected joint. As you can see in our illustration, as it highlights the presence of the uric acid crystals that are seen microscopically. Clients experiencing chronic gout will present with chalky white nodules within the joints. This may progress to include tophi formations. These are clusters or clumps of uric acid crystals that have now formed within that synovial joint. Nursing interventions for a client who is experiencing acute gout exacerbation. Our goal will be to reduce inflammation and pain, offering NSAIDs such as ibuprofen and naproxen, as well as the administration of colchicine. We want to care for that affected joint. Elevate that limb, immobilize it as much as possible, apply ice, and avoid pressure or touching of bed clothing. We also want to make sure that the client is staying well hydrated, encouraging 2 to 3 liters of water a day unless contraindicated. For a client who is experiencing chronic gout, our primary goal is to reduce serum uric acid and prevention of those acute attacks. We will see the use of a drug known as allopurinol. This reduces the formation of uric acid crystals. The client will be taking this long term. We do not want to start allopurinol during an acute exacerbation because it can precipitate acute attacks by breaking the crystals. We will also instruct the client to avoid high purine or high protein foods. Examples of this would be organ meats, wines, and aged cheeses. We encourage weight reduction if obese, and again, avoid alcohol consumption because it is high in that purine, which can break down into uric acid.